Good afternoon, hello and namaskar. I am Sanjeev Pandya welcoming you to the another edition of the Ayurveda Mantra Show. In this show, we talk about importance of Ayurveda and Panchkarma with Dr. Ambika Nair of Santigram, Kerala Ayurveda Wellness Centers, USA. In case if you're a first time watcher of the show, I tell you that you may have missed some important information about some disease and how Ayurveda can cure that disease, but each week we talk about certain disease and we give you as much information possible. And Dr. Ambika Nair, having 30 years of experience in treating individuals through Ayurveda herbs and Panchkarma treatments, is with us once again. Dr. Nair, welcome to the show.
Thank you, Sanjeev.
How are you?
I'm doing very good.
Well,
you are also looking very smart.
Thank you.
Undergoing some Panchakarma
Maybe it's Ayurveda. You know, if not practicing Ayurveda, just by talking to you and knowing a lot about Ayurveda makes a difference.
Yeah, no, you're practicing.
Very good, thank you. You know, Dr. Nair, in this episode, by popular demand, our viewers want us to talk about asthma.
Okay. Oh.
Asthma, I think, is something that many people are affected by it.
Yes.
And कहाँ से asthma शुरू होता है and शुरू होने के बाद how it can be prevented, how it can be cured. So Dr. Nair, Ayurveda के जरिए asthma के बारे में बताइए.
Actually, it's an obstructive disease of the lungs, you know.
Oh.
Yeah, especially obstruction on the airway. So that, you know, that the air doesn't go to the lungs and person cannot breathe properly. That is the first sign what you will see.
Correct.
Yeah. It can be like a very chronic also, acute also, so that you know, like it will be classifications are there like that. And especially weather change, some people with anxiety, they will show that they cannot breathe at all. So there are so many things what we do.
Okay, one of our viewers want to know, doctor, that only smokers get asthma or non-smokers get asthma also, since lungs are part of this?
Not like that. Actually, smokers also get it. Non-smokers also, passive smokers. If you are standing and smoking, if I don't smoke, I am a passive smoker. Let us talk what happens, you know, why they cannot breathe. See, normal bronchial tube means now you are talking, I am talking, but if I have an asthmatic attack means I may not be able to talk like this, you understand? So because of the why that heaviness comes, because the lungs cannot like breathe properly, okay, that they cannot, that effort has to be there. The person, they will be doing a labored breathing, you know, like a shortness of breath. Okay. So because of the swelling in the bronchial tubes, okay, because it will be inflamed like that, there will be like a water. So you are like dragging, like forcefully breathing.
Wow.
Oh, that is
But
the real obstruction.
That's a severe asthma.
No, in acute also it will be like that, because asthma will be like that, because labored breathing will be there. Yeah, that is there.
Okay, and what are the early symptoms of this asthma?
See, early symptoms means asthma can, you know, attack. It is an asthmatic attack. It's a chronic. There are, see, like a chronic is there, acute is there. You understand? In a dusty environment, it was very smoky or dusty. If you have gone over there, you choke.
Correct.
And you won't be able to breathe because you are not getting it, because everywhere it is blocked for you. So these things, you know, that is an acute. So you must have not experienced it before, but it is. But there are chronic also, because chronic means because this person is suffering since 30 years, 35 years.
I see.
So how it comes also, it is very interesting, because it's not a must that this fellow should be getting any cough or cold. Some people doesn't get anything like that. They just get, you know, like wheezings, you know, like that is with the vata.
Okay.
Normally it is with the kapha people also, with the vata people also. Kapha is, you know, like more mucus will be there. Okay. Rattling will be there and heaviness in the chest. Okay, they cannot. Like some people, you see that when you see a person, you know, you see that they have like so much of blackness.
Correct.
Okay, that you can see.
Yes,
I'll take out my glass.
Correct.
Okay, you can see how so much, you know, like darkness is there. This all like black. Their body color will be different. So this is all like a shortness of breath, I should say
Shortness of
that.
breath.
Yeah, this is lack
Wow.
of oxygen.
But there are a number of reasons for those dark circles
Yeah,
and dark skin.
but one
around
of the
eyes.
reason I am telling,
One of
some
the reasons.
people, you know,
Acha.
like because some people, because at the back of their eyes, you can see that it is very, yeah. So many causes. First is dust allergy, then the pollen,
Correct.
okay, weather change. Now here itself, now it's like one day it is very cold, one
Oh,
day
we
it is
live
very
different
hot.
seasons
So that, yeah,
every
that
other
you are,
day.
you are going in and up
Correct.
and down like that. So naturally you can see like a viral infection is there a lot. So these all, you know, properly not treated, it will become like, you know, it will come to the, see, all the mucus accumulated over here, like a post-nasal dripping, you know, they have to open their, you know, like a cough it out. So when it is swallowed over there, you know, like it will come to the chest. That's why then it get accumulated in the chest. So that's why the breathing, you know, like heavy breathing will happen. And they won't be able to eat properly. They cannot sleep properly. In sitting position, they like to spend their night if it is a very bad asthma.
Wow.
Okay, so at that time bronchodilators and all allopathic doctors will give, even steroids will be given to those people.
If a person is a smoker
Yeah.
and person gets an asthma, does it make it worse because you are a smoker?
Definitely.
It makes it worse.
Definitely.
So
I
that
will
person
scold
should
them.
stop smoking?
I will say that whoever comes to me, I'll tell that.
The first
How
thing
much
to-
you are going to help, I will help you more. Can you
Correct.
quit from the smoking? Don't tell me like that. Okay, I will, okay. But they know that. See, the fibrosis happens, you know, that it will be very difficult later.
And I've seen many people with a pump, that they
Yeah.
use the pump, right?
Yeah,
To
to
send
get the-
air
yeah,
into their
air in
lungs
their
and stuff
lungs,
like that.
absolutely,
How
yeah.
effective are they? And
It is all steroid,
Okay.
cortisone, and
Achha.
bronchodilators are there.
Okay.
Okay, in this country, because I have seen that it is like a maximum, everybody will be having these issues
Correct.
like that. See, they can take care, but they don't know what to do because they always go. First of all, because of the insurance, they always go to the, you know, like because this Ayurveda was not here before,
Correct.
so they don't know whether we treat Ayurveda in this country, because always, you know, people used to think that Ayurveda is only Shirodhara. So just, you know, like it is some conversion. People used to ask me. So these all like false, you know, like the things were communicated to these people. So now only like treating for the cause, we are, you know, like
It's a
making
good,
them understand,
exactly.
yeah.
It's good that
Yeah.
you're shedding more light on this Ayurveda and Panchkarma and then herbs and oil and whatnot. Anyway, viewers, we're going to take a short break. And when we come back, if you have asthma, what you need to do and how Ayurveda can help you to cure that, we're going to talk about that after the show. Welcome back to the Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Centers USA. Right before the break, we started to talk about asthma as some of our viewers are requesting Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Center to talk about asthma. Asthma is something which we know it's very common. And obviously, you know, you can take antibiotics and you can use that pump, I guess, for temporary relief. But how Ayurveda, through Panchkarma and herbs, it can cure. So let's talk about that, Doc. What do you need to say from Ayurveda point of view about this asthma?
Especially it is seen mostly in children also, and in the adults also it is seen. So they will tell that, you know, like bachcha to bilkul theek tha. You know, suddenly, you know, like it aggravated in the night.
Correct.
He was all right. He had little cough. This is the thing what they will tell. And always, you know, nobody will come directly. These days only people are coming directly. Otherwise, you know, because who knows about Ayurveda? Otherwise, antibiotics, you know, like monthly we give twice antibiotic, monthly we give thrice antibiotic, and he was on always on cortisone shots. You know, we are giving nebulizer. And I have some clients, you know, who drive from Pennsylvania 2.5 hours
Drive.
one way. 5 hours to get the treatment. We tell him that you stay over here. You know, he was telling, no, it's easy because I can see the other children also. Because of that asthma, this child's growth was retarded actually. Now I can confidently say that child is totally out from all those pumps and everything.
Very nice.
Like 7 month completed now. Okay, so we have done, like very special treatments are there, like urovastis and all. So we have done all the treatments. So recently he called me and told, oh, he is having little bit of like a body ache, fever. Can I give nebulizer? I told, still you are stuck with that. I'm not telling nebulizer is bad or anything. I told to give him those medications. You already have the herbs with you. He told, okay, after giving, he told, okay, wow, very good.
Okay. That actually prompts me to ask you a question. Last week, we talked about rheumatoid arthritis, RA, and today we're talking about asthma in our this Ayurveda Mantra show. You mentioned a young age, kids, right? Let's talk about asthma. Kid at such a young age, right? What would be the reason for them to have asthma?
Too much of cheese.
अच्छा,
Consumption of too much of cheese.
क्या बात करते हो, really?
सच्चाई बोल रही हूँ. Actually, see, in India में आप कितने चीज खाते थे, सच बोल.
बिल्कुल, बहुत ही. Maybe साल में अगर एक दो बार
नहीं,
खा
साल
ली
में
तो
चलो weekly.
अमूल cheese
But
or
ठीक है,
something
नहीं,
like
otherwise paneer also, like.
Paneer a lot.
Yeah, we eat a lot. But I am telling in here, what they do is that they give excess, cream. Everything is excess. What they cannot digest. So this is kapha oriented, you understand? No? So all accumulation, children are going for every activity, everything. So what all they can digest, we should see that what they can digest.
See, that's why our viewers, they should make a note of that make sure that your kids are not eating that much of the cheese.
Like overdoing the things.
Overdoing
actually.
the thing, yeah.
This is too much.
But they have it every day. They have it every day, either in a sandwich or their
everything in a like a normal manner. Everything will work. Actually, when you are sick, if you keep on like pumping the things, where it will be? It will become another, like asthma people, like when they come, 90% of the people are like constipated. Yeah, because they cannot, see the bowel movements, all the amam is getting accumulated in the chest.
Correct.
So the vata is like totally prana, like it is already blocked. So the movements are not there. It is going like urdhva, like it is going like on the upper part, they will, like that they will be gasping for the breath.
Correct.
Okay, this is what happens.
So what kind of diet that you advise for people with asthma?
Diet will be only cooked food and very light food.
Acha.
Yeah, it should be like soups are there. Okay, they can have only warm things.
Are they okay with salad? Are they allowed to eat salad?
Never, only cooked food, no salad at all. Salad will again accumulate. And here, everybody takes smoothie. When they come, we'll tell that no, that is my diet. Then I make them understand, blend it and make it, everything they will tell. See, they can take when they are healthy, but when it doesn't, when they take the smoothie, it accumulates over here. I always tell them, notice tomorrow you do one thing, you take smoothie, then you see that, how you feel from your chest. They will tell, yes, you are right, feeling so heavy.
Correct.
Then they have that heavy, see, like deep sighing, like, see, if you are like this, this is asking for the oxygen. These people will be doing like that. Yeah. And if you don't take care, that it will only lead to fibrosis. That's the thing.
Very interesting. Anyway, viewers, we are talking about asthma in this week's Ayurveda Mantra show. We're going to take a short break. And when we come back, we'll have more for you on asthma. Please stay right there. Welcome back to the Ayurveda Mantra show by Santigram Kerala Ayurveda Wellness Centers USA. Every week, Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Centers USA joins us in the show, and she basically talks about importance of Ayurveda. Should you have any question about disease or anything that you want to know how it can be cured, please do send us an email. We actually encourage you to ask us a question, and Dr. Ambika Nair will be more than happy to answer your question. Our email ID is info@santigramusa.com. That you will see it on the screen, info@santigramusa.com. In this episode, we're talking about asthma, and Dr. Ambika Nair gave out a lot of information on asthma. Asthma, is it related to occupation, whether you work outside and certain job, really?
Yeah. See, like we see ruई के साथ cotton cotton mills.
Acha.
How? Because
Oh,
actually this
yes.
is all occupational hazard.
Correct.
See, not only with this asthma, see, when they have like the eczema also comes, you know,
Yes, yeah.
either with eczema or with asthma. So we are talking about chronic, you know, like asthma, so I'm telling that. See, and cotton field mein jo karte hai, and some people cannot work in them because this is all allergy. They cannot work in the soil. Okay,
Ji.
that smell.
Ji.
So, you know, like anything related. And another thing, they can mine workers, you can see. And who works in petroleum, that smell,
Acha.
they will become asthmatic. The moment, you know that if the smell is like that, painting chal rahe to, when you go, that you feel sometimes breathlessness.
So especially people who work at the
over
gas
it.
stations.
Yeah, gas
right?
stations, sometimes.
People who are at
No,
a toll booth.
petroleum, not only in the booth, in the, you know, mines,
In the
you know,
mine
like
also.
a petroleum
Correct,
industry
correct,
where
correct,
they
correct.
work, you know, that, you know, how they take it out. Okay, so this all they
And
work
obviously
on
you mentioned earlier also pollution in the air
pollution is too
goes
much
into
actually,
your body.
yes, okay, and the latex company, like a gloves, all those making, and anything related with, you know, like, and chemicals are there, all these chemicals also, it will come like this.
Okay.
And the soldering, you know, like the welding people, how they weld it, that gas welding, so this all will come, you know, like mine workers.
Good. Now let's talk about prevention.
Yes.
How it can be prevented if asthma is in very early stage.
Occupational, we'll tell them to change the profession. Okay. Some people, you know, because it is their own. Because very interesting. I had a client, you know, in Delhi. So they have, you know, like they are wholesale merchants only for lesson, garlic. And this fellow is so much allergic to that. He has to go. So when I told, you know, like change the business, you know, so he told, you know, like how can I change, because that is my roti.
Bread and butter.
So yeah, he was telling me, ये तो मेरा रोटी है, आप कैसे बोल रहे हो? फिर आप मेरे को भिजवा देना. Then I told, okay, we have certain, you know, like therapies also, like Panchakarma therapies, like Nasyam, Urovasti, and there are very good diet, you know, like and very good herbs.
At the same time, we should let our viewers know that for every single disease, whether it's asthma, whether it's rheumatoid arthritis, whether it's arthritis, or any disease that you have, the Panchkarma treatment is different for all those things. Different herbs, because
customized.
Correct. I want our viewers to know that at Santigram Kerala Ayurveda Wellness Centers, for every single different disease and depending upon a person's body,
Yes,
right?
constitution.
Correct. So, you know,
Customized treatment.
customized treatment, right?
Yes.
Mixing has been done, and that's why Santigram Kerala Ayurveda Wellness Centers is the best in the country, and they follow true, authentic Kerala style Panchkarma treatment with right herbs and oil. So now this for asthma, same thing will follow also.
Yeah, definitely. And you know, like, see, we can see like overdoing the things in our athletes also, you know, like so many will have, because when they overwork, because there will be constriction in the bronchioles, you know, so you can see them, you know, even the cyclist, they, you know, that they panting for the breath. So these all are very common. So you should not overdo anything.
Yeah, you should not overdo
so
anything.
indulge in so much of, you know, like after eating any oil, you keep on working at different virutha ahara, we call it as like opposite food. So these all we write very properly. Not only the consultation comes under, it's for you all, you know, consultation is not only, अच्छा आप तो pulse पढ़कर वैसे बोल देते हैं, वैसे नहीं बोलते, we see what is inside you. Okay, so then we will write what is the problem and how it can be taken care, how you will take care, how I will take care, so that you can come out from the problem very fast.
Very well said. And that's what Santigram Kerala Ayurveda Wellness Center, USA is all about. So asthma, which can be cured at Santigram Kerala Ayurveda Wellness Centers, this Panchkarma treatment, is it like 7-day treatment, 14 days,
It all
21
depends
days?
upon. First of all, they will always have the heaviness in the left, you know, like chest, you know.
Correct.
So we give the Uravasti is very, very different actually, with the special oils are used for all those things, because it opens up everything. And another thing is that our very good herbs, and they can also do a lot of at home also, you know, like avoiding the foods, like taking curd at night. Yogurt के बिना हमें नींद नहीं आता, नींद नहीं आएगा तो फिर अरे आपका सांस तो चढ़ जाएगा. So don't eat it. And eat the food, you know, at least, you know, like 1 hour before you sleep.
Before you go to bed.
Okay. And asthma people, you know, we always tell that eat very early as possible. Take only warm food. Don't eat full stomach. This is more important. Because then, you know, like you get all the blocks and you cannot. and at least like in the room thoda sa chal ke dekho, TV ke samne ekdam baitho mat, at least 2-3 minutes you walk. Okay,
It makes a difference.
yeah,
This
and
little
you
things
can
makes
do
a big
little bit,
difference.
yeah, and honey is very good, honey and turmeric you can take, and sound, all these things you can always use at home. Okay, this all very nice, and in warm water, only warm water, that is more important. At that, if you have an asthmatic issue or any sinus issue or anything like that, don't take any milk products for some time. Okay, so that will remove. Even banana we don't give, grapes we don't give.
Any long-term side effects of asthma? Let's say if a person does not want to go for Ayurveda and wants to stick with which we call antibiotics.
They know their own complications, as they they cannot even walk properly with the breathing. We get a lot of clients like that. They come with oxygen.
Correct.
Sincerely.
And in the end, more female with asthma or male or any ratio like that?
No, that all same only.
It's all same.
Proportion is always same. Ratio, it is always same.
Really?
Yeah. But children are more affected, I have seen.
That is very alarming.
Very,
almost every single episode you mention children, and you mention it with example that children have come to your center
So
for
many,
cure.
still every day coming. So, when they come, their focus, they will tell, oh, they cannot focus, they cannot focus, they cannot focus. When we do the nasya, see, they will tell that, like, nasya, tum to do boond dalte hai. This is not do boond dalne ka. There are so many medicines, there are nasya itself is what you can do at home, what you cannot do at home. Treating for the cause, the medicine defies, because this is the only entry to the brain.
Correct.
That's why everybody thinks like that. So, like a medicine defies, and it is always individualized, customized treatment what we do.
Very well said.
Okay.
In the end, Dr. Nair, today's Ayurveda mantra, the tip of the day.
Tip of the day, if you have an asthma, please don't take anything cold. And no soda, no ice cream. You forget about it for at the summer time, and you can take honey and turmeric in the morning. अपने घर पे थोड़ा सा like घरेलू चीज़ें like काली मिर्च थोड़ा सौंठ ये सब मिला के like long, you can just make a tea like you can take with jaggery. This also helps a lot. And there are like very light food, as I told before, like take light food, do a breathing anulom vilom every day in the morning, at least for 2-3 minutes.
Good point.
Yeah.
Very good point.
Very good.
Dr. Ambika Nair, thank you so very much once again for letting us know more good stuff about Ayurveda. And, thank you for your time. We'll see you next week. Thank you. And the viewers, if you have any question, remember to send us an email, info@santigramusa.com. As a matter of fact, I suggest you to visit website to get more details on Santigram Kerala Ayurveda Wellness Centers USA. And once again, your questions definitely at info@santigramusa.com, and Dr. Ambika Nair will answer them in the next episode. Until we meet again, stay happy, stay healthy, and take care of yourself. See you next week.
Namaskar.